Hi, I'm Virginia Governor Ralph Northam, and you're listening to the Patients Come First podcast.
Greetings and welcome to the Patients Come First podcast. On today's episode, we're happy to be joined by Sherry Kolb, the President of Qualivis, a national healthcare workforce solution organization that partners with healthcare providers to offer staffing services. In a moment, we're going to chat more about Qualivis and its role in addressing healthcare workforce needs. But first, let's welcome our guest to the show. Good morning, Sherry. Thanks for being with us.
Good morning. Thank you for having me.
Well, it's our pleasure, and we appreciate you making the time. Before we discuss healthcare staffing, let's introduce Sherry Kolb, who joined the South Carolina Hospital Association in 2002 to help build a healthcare staffing program, which ultimately became Qualivis. She is a registered nurse, and she spent 20 years working in South Carolina hospitals. Sherry, what else should our listeners know about you?
It's true. I've been a nurse for over 30 years now. My career started in healthcare at a hospital system where I was actually born. And I spent 20 years in that healthcare system working as a nurse tech, a nursing leader, a recruiter. And then I became interested in doing a little more. So an opportunity presented itself at the South Carolina Hospital Association with a Duke Endowment grant, and I applied for a position with these new workforce initiative programs through our hospital association there. And we started that in 2002, as you mentioned, and here we are 16 years later running a national workforce solutions company right here out of Columbia, South Carolina, and helping many hospitals across multiple states with any workforce needs that they may have.
And we're going to talk a little bit more about that important work here in just a moment. But to sort of set the stage for our listeners, we're taping this in mid-December. It's the holiday season. And so I'd like to ask you one seasonal personal question. Sherry, what is your favorite holiday song, and why is it your favorite?
Oh my favorite holiday song. I don't know that I have a song. Probably White Christmas.
A white Christmas.
I'm kind of more of a traditional girl, so I like those traditional old songs, Bing Crosby and those types.
Well, that is a classic. It's one I enjoy as well. And since we are both residing in the South, where VHHA is obviously in Virginia and Qualivis is based in South Carolina, we don't see a lot of white Christmases, but they're always nice. Let's tell our listeners a little bit about Qualivis. It's a VHHA shared services endorsed partner, which provides VHHA member institutions with vetted products, services, and resources to help improve performance. Qualivis is the preferred staffing partner for hospital associations in 13 states, offering healthcare providers access to a national network of more than 100 staffing firms. They are online at www.qualivis.com, which is Qualivis. Sherry, what are some of the benefits Qualivis can provide in terms of workforce solutions?
Yeah, so actually let's start with the rebrand of our name that we just announced in January. So it's been almost a year. So let me tell you a little bit about Qualivis and how we derived that name. Based out of the South Carolina Hospital Association, as we thought about workforce strategies and how we wanted to help ultimately with patient care, because that's really what this boils down to, is having enough caregivers at the bedside to help our patients every day, is quality. So quality is our number one core, the core of our DNA, is we want to assure that the folks that we have at the bedside or working within our healthcare facilities in our states are competent and qualified to be there and will do the best job possible. Often, hospitals struggle with finding these folks on a permanent basis, so they'll turn to companies like Qualivis to help them on a temporary basis to bring in some folks during, you mentioned seasonal. I know we were talking about holiday songs, but it's flu season right now. Census is very high in our hospitals. You may not necessarily want to work as many nurses throughout the year as you're working currently, but with an increase in census and an increase in patients, oftentimes you'll need additional help just for certain events or periods of time. And so Qualivis wants to make sure that those folks that are coming in to help your core staff are highly qualified and competent in what they do. The other thing that we're seeing in the workforce is this ask of work-life balance. So if you think about life, and that's the second indicator in the Qualivis name, we want to assure that healthcare workers are receiving that work-life balance that they've focused on so much over the last couple of years. And as we have multi-generational groups in our workforce, we have to make sure that we're meeting all of those work-life balances. And then, of course, our vision for the future is to be a collaborative partner with all of our healthcare associations and our healthcare facilities to assure that we are achieving their vision for what they need and the future of their organizations. So I just wanted to share that our name is reflective of all of our core values, and that being Qualivis, quality, life, and vision.
Well, thank you for that explanation. Let's turn our focus to healthcare workforce issues more broadly. Healthcare jobs are projected to be in great demand in the years ahead, particularly as we see baby boomers age into retirement. Here in Virginia, community hospitals directly provide more than 126,000 good-paying jobs, equivalent to about $8 billion in payroll. And more broadly, healthcare accounts for about 11% of the workforce in the Commonwealth of Virginia, about 1 in 9 jobs. Looking ahead to 2025, which is just 7 years from now, the U.S. Department of Health and Human Services projects an 8.9% adequacy shortage in primary care physicians. As you survey the healthcare workforce landscape, Sherry, what trends do you see regarding workforce staffing challenges and solutions?
So we are definitely facing a more severe shortage than I think we have in the past. And it's not just a numbers game. You know, depending on what data and trends you look at, some research will show that we have a surplus of nurses or healthcare providers. But often that's not true. If you think about where the desperate needs are, they truly are at the bedside. And so, you know, there are more jobs available to folks that go into healthcare professions today. You know, more of our finance people, our IT people, our case managers, these are all clinicians many times that may have been, in the past had worked in a hospital or stayed in a hospital setting for most of their career. I think our hospitals and our healthcare systems are challenged with the additional job opportunities, as well as you mentioned the retirement. You know, many of the folks that stayed through the last recession and not only re-engaged in full-time employment but stayed for the last 5 or 6 years are now really ready to retire. The average age of a nurse in America is probably closer to 50 than it's ever been. The other statistic that's a bit misleading is, and I just had this conversation at a Virginia hospital this morning, is nurses, even though the number of licensed nurses may indicate that there are more of us in the workforce than ever, many nurses, we're a prideful bunch. We don't like to give up our licenses. And so if you think about 21% of the registered nurses in the United States are not practicing at the bedside. Many of those are actually retired or home taking care of their families versus actively working. And so when you look at the data, you have to look at more than just one research point. The reality is the shortage is very strong in most of our acute care facilities, particularly around the area of direct patient care. And that's true also for physicians, therapists, and technologists.
Well, that's a great point about really sort of probing deep into the numbers to get an understanding of what they actually reflect. And I certainly have heard anecdotally the point you've made that many nurses who still have an active license are no longer in the active workforce. So that's a great point, and it's great to know that Qualivis is available to support healthcare providers and hospitals with their staffing needs. Before we wrap up, we're going to close with a few lighthearted questions. We talked about physician staffing a few moments ago. I wonder, what is your all-time favorite TV doctor and why? And there are many great choices, from Hawkeye at MASH to Marcus Welby to the docs on ER, Doogie Howser, you name it, Grey's Anatomy. I don't watch all of these programs, but there are many, many programs focused on on TV doctors. I wonder, Sherry, if you have a favorite over that lineage.
Well, surprisingly, I recognize all of the characters that you've named. I may be a little unusual. I don't watch a lot of those medical shows, probably because I want to always point out that they're doing something wrong. So I just want to say though that when I do sit down and enjoy them, I watch them for the compassion and sharing the story of the likelihood that someone could have a great career in a healthcare field. But I'd have to say, if I had to choose one, Doogie Howser. I'm a middle-aged nurse, and Doogie has always been a favorite of mine.
I like Doogie Howser as well, and maybe given your observations about some of the inaccuracies, we need to get you on set of some of these shows for some quality control and some accuracy.
Yeah, that'd be fun.
One other question that we like to ask, and it's a question we borrow from a popular BBC program. If you were stranded on an island by yourself, what one book and one album would you take with you? And we will spot you a copy of the Bible. So other than the Bible, what one album and one book would you take to keep yourself occupied?
I would probably say album would have to be something from the 70s. Maybe something by Fleetwood Mac.
And I saw my reflection in the snow-covered hills till the landslide brought me down.
Or, Heart.
So this ain't the end, I saw you again. Today, I had to turn my heart away.
Just some of that good old classic rock and roll kind of stuff, and so as far as a book, I don't know. Let's keep it nice and simple. Something by Dr. Seuss. He just seems to have great advice for no matter what the situation is.
Congratulations! Today is your day. You're off to great places. You're off and away. You have brains in your head. You have feet in your shoes. You can steer yourself any direction you choose.
Well, those are two great recommendations, and we appreciate you sharing those with us. And again, if you are interested in learning more about healthcare staffing, you should visit Qualivis at www.qualivis.com. And happy holidays to all of our listeners. And Sherry, thank you for being with us today.
Thank you so much.
That's going to do it for today's episode of the Patients Come First podcast. You can find new episodes as they become available at www.vhha.com. You can also find episodes of the podcast on SoundCloud. We also encourage you to engage with us on social media, including Facebook and Twitter. If you'd like to send us comments, questions, or feedback for the podcast, you can do that through our Twitter account at VHHA using the hashtag PatientsComeFirst. Thanks.